So thank you and welcome to today's dental implant webinar. My name is Ed O'Flaherty. I'm one of the team here at Seapoint Clinic. Really do appreciate you joining us and good to see so many people here. At Seapoint Clinic, we've treated thousands of people successfully with dental implants just like you. If you do have any specific questions at any time, please do email us on info@seapointclinic.ie and we'll get an answer back to you as soon as possible. So what are you going to learn today? On today's webinar, we're going to talk about what dental implants can do for you. What are they? What's involved in getting them? Are there alternatives that you can consider to dental implants, or is it just a case of there's only one way of replacing a missing tooth? You'll hear what other real people who've had implants think. We'll give you some links to testimonials, and then you'll hear about the Seapoint Clinic. As a special bonus for listening to the end today, we've got an attendance bonus for you, and you can print that out and bring that with you for money off your consultation. So one of our strengths at Seapoint is the amount of happy patients we've had over the last 10 years. We do have a lot of testimonials, a lot of reviews from people just like you who've been through the procedure, found it very, very valuable, and we're happy to tell the world about it. So we would encourage you to check out our website, go to the reviews page and have a look through some of the many videos we have, say, of patients who've been through the whole procedure. We can talk about it to you, but seeing somebody and listening to somebody who's been through it is probably much more valuable. So tell me about the clinic. Seapoint Clinic was set up in 2007, so we're 10 years now, next year, established. And we want to change the way people thought about dentistry. Up until then, people found the experience uncomfortable. They often met grumpy dentists. Clinics tended to be old-fashioned and had that horrible dentist smell. So we realized we wanted to change something. We wanted to do something different for Irish patients. And we traveled the world looking for the very best clinics, looking for boutique hotels and trying to get a combination right that would be a beautiful, safe, and comfortable environment. A place you can relax in instead of a place that you come and be stressed in. One of the reasons we think we're so popular with anxious patients is they really don't feel like they're visiting a dentist when they come in the door. It's something that we're very, very proud of, and we hope it'll make you comfortable too. Since we set up, we've added great technology over the years. We've added some low-dose CT scanners, advanced 3D milling machines, all of which can make more comfortable treatments, better results for you, and a more comfortable experience. It's funny that what people most commonly comment on, I think, is probably the TVs we have in every surgery. Having a TV to watch above you instead of having a cracked ceiling is something that everybody seems to notice. Some of our latest equipment, some of our chairs even have massage functions, so you can actually feel like you're on a first-class flight. We do even offer hot towels to try and make you feel as pampered as we possibly can. Another, I think, very important thing about the clinic is that we offer so much in one place. We offer all your dental needs to be catered for in one place. For people traveling from around the country, it's very valuable to be able to do that. So here's a little overview of the clinic. And you can see it, again, it looks very different to what you'd have expected a dentist to look like. We are regularly featured on RTE, and we're the resident dentist on the afternoon show. And we've been on TV3 and won lots of awards over the years, something we're very proud of. We think it makes a difference for you to go somewhere that has a good reputation. The team we have, again, is very important. We really do look for people who are going to be very nice to you, who are very welcoming. We really don't want to have a grumpy doctor's receptionist. You are a guest, and you're the most important person in the world when you come to us. So going on to dental implants. What are they and what can they do for you? What do dental implants mean for you? What it really means is no more loose dentures, no more sore spots from your denture moving around, no embarrassment, no dentures falling out when you're talking, no dentures falling out when you're laughing, no dentures falling out when you're smiling or when you're blowing out candles in your birthday cake. It means getting rid of gaps in your smile, so you're not covering up your smile anymore. Too many people put their hand up in front of their face when they're getting photographs taken. And it's something that we love to do, is to try and stop people having that need, to let them show the world their smile, show the world their full expression. And again, people generally feel wonderful when they have that taken care of. So dental implants, what they basically are, is they are a man-made root. You can see here, it's a man-made root. It looks pretty similar to the root of your tooth, and it's usually placed into the bone very, very gently, left alone for a few months to heal, and then we go ahead and make a tooth on top of it. So the aim of the game is to make a tooth that looks and feels just like your own. The main benefits of dental implants are, again, you can eat what you like. There's no risk of tooth decay with dental implants. It's wonderful to be able to eat sweets and eat all the nice stuff and not worry, will my teeth get decayed? As long as you have implants, your implant won't get decayed. If you still have some teeth left, you've got to watch out for those. Again, dental implants generally feel just like your own teeth, so most people don't even know they have them in. A lot of people actually end up reaching for them and, to take out the dentures at night when they're brushing their teeth, and then have that beautiful moment of realizing they now have their own teeth. Dental implants are really good for bone maintenance, and we'll talk about that a little bit more later on. With dental implants, there's no need for us to drill or prepare the neighboring teeth like there can be with some dental bridges. What that means is it's very gentle on the other teeth. We can protect and preserve your other teeth and don't have to damage them in any way. Again, another benefit is that they're fixed in place. If you get fixed teeth with dental implants, the teeth are actually fixed in place firmly. There's no movement whatsoever. No more denture adhesives required. Some people end up eating so much denture adhesive over the years. Some people fill up their mouths with denture adhesive, and we even see some people filling it up a few times a day. It really can't be good for you. There's a lot of high levels of chemicals in adhesive. Eating it isn't good for you. And then confidence. I think confidence is probably the most important one for people. Between confidence and comfort. If you're able to smile and talk and laugh and just do all the social things in life without worrying about your teeth coming out, it makes a massive, massive difference for people. Again, comfort. If you can actually taste wine again, have your palate free again, have nothing moving in your mouth, and just literally forget about your teeth. That's the aim of our game, is to help you forget about your teeth. They're just there. They just do their job. You don't need to worry about them anymore. That's what we try and do for you every day. And the other thing is the potential for a long life. With dental implants, they are on average are the longest lasting restorations. So the tooth replacement that lasts the longest generally is dental implants. That's not to say, everything lasts forever. Dental implants do have some disadvantages. Cost would be one of the ones that comes across most often. Over the long term, dental implants are generally very inexpensive. They tend to last a long time, so that means you get a lot of value from the years. And there is a need for a surgical procedure, generally very small, but again, it's something that has to be done. And then it's important to say that dental implants aren't 100% successful. They're generally about 98% successful in the first year, and then over time that drops off a bit. So on average, about 15 years later, 80% or so, or 85% of implants are still in your mouth. So what can be done apart from dental implants? Is there anything else that can be done? And the answer is, of course, yes. A lot of people will end up getting bridges or dentures done. And what a bridge is a bridge is something here that involves crowning your neighboring teeth. So that means you've got to drill the tooth down. You've got the risk of sensitivity or even sometimes needing a root canal treatment in the tooth. The tooth is generally quite weak after the procedure, and therefore there's a risk of fracturing potentially in the future. Bridges can be useful sometimes where forces are very high, so where you grind your teeth a lot, where you already need to have crowns on the neighboring teeth, they can end up being very useful. They're a bit faster generally than implants to have done as well. So again, depending on your individual circumstances, sometimes that might be a better option. And we'd always be very honest with you and tell you, what will work best in your mouth. Dentures then are, say, the traditional method of replacing teeth. The big issue with dentures is they are big, they are bulky, they do tend to move around a lot, and people generally find them very, very uncomfortable, which is why we very, very rarely recommend them as the solution. One of the biggest reasons people come to us here at Seapoint Clinic is they're struggling with dentures. They've hated having dentures for years and years and years, and they just aren't at all happy. So getting rid of dentures is something that we do every day of the year, and it's something that makes our patients very, very happy. The other alternative, of course, to dental implants is not to do anything, to stay as you are. The only thing with that is that, unfortunately, things never stay the same. So over time, if you're wearing dentures now, your denture will get looser and looser over time. That means that you get more and more uncomfortable over time, and the embarrassment and the issues can occur over time as well. We, as I say, don't like dentures at Seapoint. Here's 26 or 25 reasons why dentures are a disaster. We're not going to go through them all now, but the main thing is they encourage bone loss, which can make you age prematurely, and they move around your mouth, they cause gum disease, they cause tooth decay. There's lots and lots of reasons why dentures aren't something that we generally recommend. The big issue then, I suppose, with dentures is the bone loss that occurs with them. A lot of people aren't aware of the denture bone loss that occurs when you're missing your teeth. So here we have an image of a lady aged 30. And again, this can happen. This is a normal adult would be like this with teeth. So when you have the teeth, there's a good height of jawbone here. The face is in proportion and everything looks well. When we lose our teeth, lots of different things start to happen. And actually this example here doesn't even show the worst of it. We've seen jawbones which are literally a few millimeters thick. The patient's even lost sensation from the nerve being compressed by the denture over the years. And it leads to something called facial collapse. And that's where the facial profile changes. It becomes much more sunken in this area here. So more wrinkles. And some people would refer to it as a witch's chin. Again, it's something entirely preventable if you avoid having dentures, if you keep your teeth. If you've already lost your teeth, dental implants are the only way to stop this happening, because dental implants, unlike bridges, unlike other options, stimulate the jawbone and encourage the jawbone to be maintained over the long term. So as I say, here we've got 30 and 75. We often see patients who lost their teeth in their 20s. So in rural Ireland particularly, people would have had their teeth taken out for their 18th birthday, for the 21st birthday. And back then they didn't realize that having teeth out over time would lead to facial collapse, would lead to bone loss, would lead ultimately to some people becoming dental cripples. Again, luckily now there are solutions to this. We can help and improve, but if you possibly can avoid getting into this situation by getting dentures replaced with dental implants, it's got to be a good thing. And again, just emphasizing that message that only dental implants can stop the bone loss that happens when you have missing teeth. So just going to run through now a few frequently asked questions. People have asked these over the years, and I think it's good to address them for you. So is getting dental implants painful? At Seapoint, we're very, very careful in trying to make the experience as good as it possibly can be for you. What that means is we use very, very gentle techniques for numbing you. So we use numbing gels on the gum, which make the injection very, very gentle. We also offer sedation. So we offer a drink beforehand, which just takes the edge off and makes people very, very comfortable. Most people don't remember anything of the procedure whatsoever. And that's amazing, to get the whole dental implant done and come out and actually say that was easier than having a filling done in a lot of cases. After getting implants generally, you will be a bit sore and swollen for a while, for maybe a couple of days afterwards. We do give prescriptions for pain medication. Again, we try and make everything as comfortable as possible for you, but the vast, vast majority of patients would say to us that the procedure itself was pain-free. So can I still get dental implants if I've lost jawbone? Again, the sooner you come back to us after losing a tooth, the better. The easier it will be, the cheaper it will be, and the more likely it is to be successful. Having said that, we can treat people no matter what. So if you lost bone years ago, there's still ways we can help you. We can still grow bone back. We can still do procedures to improve the bone in the area. But the message would be, the sooner you can after losing a tooth, the better it is to come back. It just makes everything easier, cheaper, faster. So are dental implants very expensive? And the answer is, everything's relative. Dental implants compared to, leaving a gap, of course that's expensive. Compared to a simple denture, of course it's more expensive. But the honest answer is the benefits of dental implants far outweigh the cost. Being able to maintain your jawbone, being able to have something fixed and secure in your mouth, which you can forget about, so you can just go on enjoying life, enjoy the foods you love, and not be thinking about your teeth every day, has a serious value to it. And again, based on how long dental implants generally last, it's usually a very, very worthwhile investment. So talking about people travel, of course, we're aware people travel all the time for dental implants and for other procedures, really to try and save some money. And it's something we think we like to address. So you can get some good value. You can get some excellent prices sometimes overseas. Some people travel to India, some people travel to Hungary, some people travel to Poland. And in each of these places, there are good dentists and there are bad dentists. I think probably the main issue that comes up with people traveling is lack of aftercare. If something goes wrong, and luckily things rarely do go wrong, but when they do go wrong, it's very nice to have somebody just down the road who can take care of it the same day. So instead of you having to go online and trying to book a flight, end up spending hundreds of euros on a flight and accommodation to get something small fixed, it's nice to be able to go down the road and get something looked after the same day. Especially when you've been through something, something maybe more in your mind difficult, like dental implants. It's nice to be able to go home and sleep in your same bed. Traveling for something surgical is more stressful. So if you can do that and be close to home, it's always much more comfortable and much more pleasant. And the other thing is, the pricing is an interesting one. We do offer very transparent pricing, and a lot of clinics overseas particularly are very good at disguising the true price. We've seen lots of clinics, for example, which offer an implant price which doesn't include the tooth. So it's not much good to you having a metal screw if you have no tooth on top. So it's one way people get misled is by having this, being told that it's a tooth when actually it's not. Another way they get misled is by having prices for the surgery itself. So they get a price for the implant, they get a price for the post, they get a price for the temporary, they get a price for the tooth, they get a price for the surgery, for the sedation. We offer an all-in price for the implant. The only extra might be if there was any bone grafting required, and again, you'd be informed of this before you start the process. The other thing that happens sometimes is people are encouraged to travel and get a treatment plan done and start work straight away. That's something we're very concerned about because, if you've traveled overseas, you don't really know if what you require is actually necessary, and you haven't had an opportunity to talk to a dentist who, would maybe give you a second opinion. For something large like dental implants, it's important to be able to work with somebody you can trust, with somebody you have a relationship with somebody who's going to be looking after it for the next 5, 10, 15, 20 years, whatever it may be. And that's very, very difficult to do if you're traveling overseas. One of the pressure tactics that's put on people is they go overseas, for example, to Hungary, they have a consultation done, and they're given, they're told, you're saving 70% on Irish prices, but those actual Irish prices are never actually shown. So we caution people to actually check and do your research and see, again, make sure it's a good clinic you're going to overseas, make sure it's a reputable dentist, and make sure that the prices are actually every bit as good as they advertise them to be. Again, we've seen some clinics who say, they give a price for implants, but you have to have 10 or more in order to get the benefit of that lower price. Again, most patients would only have a few implants, so you're not achieving the same value from one that they suggest you would. So how long does it take to get dental implants? This, again, is a very varied answer to this. It really depends on what's required in your mouth, how good your bone is, how strong your bone is, how recently you had teeth taken out, for example. We do offer the whole range of treatments at Seapoint. That means we can sometimes do dental implants the same day as the tooth comes out, and sometimes give you fixed teeth the very same day. And that's called teeth in a day, and it's a wonderful option for some patients who choose to go with it. What generally is the most researched, the most tried and tested and safest way of doing it is to take a tooth out, allow it to heal for a number of weeks, and then place a dental implant. Allow that to heal undisturbed at or below the gum level gives the very, very best chance of success. And that's, again, what we're looking for, is to try and give you the best chance of long-term success. So we try not to rush a 30-year result for the sake of a few weeks. So on average, from the time an implant goes in until the time the tooth is made and finished in your mouth is probably about 4 to 5 months. Again, it can take longer if your bone is very soft or very weak, or you have health issues. We'd often wait a bit longer, but that's probably the average time. Again, talking to your dentist, you'll get a customized treatment plan. We'll take a CT scan, which is a three-dimensional x-ray of your mouth, and that'll give us a really good idea as to how strong your bone is and how long we're likely to wait to make your teeth. So why do we need a CT scan to get dental implants? A CT scan is one of the things we use at Seapoint, and we're now in our second CT scanner. We were the first dental clinic in the country to get a CT scanner back in 2007, and now we're on our second version of that. And what it is, it's a 3D scanner which allows us to see your bone, to see your nerves, to see everything in your mouth in very, very excellent detail. What that means is we can plan very, very well ahead of time. So we know what size implant we need. We know how strong the bone is. We can see if there's any major defects in the bone that would require some treatment beforehand. So it really gives us a very, very good way of knowing what we're doing before we start out. Some clinics don't have a CT scanner, and that means they are, flying blind to some extent. They can't see before they start out what's there. So we always recommend and take a CT scan before we do dental implants. So what's next? What should you do next if you want to go ahead? The next step is always to have a consultation with an expert implant dentist. Give us a call on 284-2570 or email us on info@seapointclinic.ie and we can arrange a consultation for you. Our expert dentist will give you a fully customized plan. So we'll talk through your concerns. We'll do a full examination of your mouth and see what problems there are around your mouth. And we'll give you a plan trying to address as many of those as possible. So as a thank you for watching to the end, we have this voucher here for you for €50 off your implant consultation and x-rays. And we really do appreciate you listening on this. Again, if you have more questions, just give us an email. If you want to use this voucher, just pause this now and click print and bring it in for your consultation. And we look forward to seeing you soon. Thank you.